Susie, I think the other important point I'd say from that is we need to remember that the GP is the specialist generalist, and therefore we have moved significantly from every bit of education and learning means going to a course run by a consultant from the hospital to actually having internal discussions and using the expertise which we have about a whole range of things within general practice. Doesn't mean occasionally lectures and consultants talking about their specialist subject aren't part of that, but a much greater part of learning is about that reflection, about the discussion that can happen internally, which is just as relevant and probably more important to your clinical practice than sitting at the back of a lecture getting bored by a topic that you're not really that interested in.
Personally, I find that in the appraisal discussions I have with doctors, the PDP goals that emerge from incidents that have happened clinically or within the practice team are far more powerful somehow than those that have arisen from a numerical piece of data such as referral patterns, although of course they have their relevance and their importance too. And for me, a PDP goal that emerges as a direct result of something around patient care or working relationships is often really, really important and tends to resonate far greater with that doctor and enables them to really focus on that as an extremely important goal for them.
One of our now retired, very senior, very respected appraisal leads said that the best PDP objectives she saw were ones that had the word patient in them.
Although I will absolutely agree with what you said, Steph, we need to be looking at learning from individual history, what's happened to us during the past year. There will still be an external element that suggests that you might need to focus your reviews, focus your reflection on particular aspects of your practice, and that will be increasing over the years inevitably. My job is to make sure that that balance is maintained, that develops your practice as well as develops the needs of the NHS, keeping that central focus around the needs of the patient as well.
Absolutely, and I think as we alluded to earlier, perhaps an ideal PDP goal would be self-contained so that it makes sense, reading it in isolation. Where did this need arise from during the discussion? What steps need to be taken, and how we'll be able to demonstrate that that has an impact on patient care or working relationships. And to me, whatever the thing that is being included in the PDP, if it passes those tests, then it's a legitimate goal